listening to me for the next few minutes. So I'm Joe. I was a chemistry major at Georgetown, and I minored in Italian. And while at Georgetown, I did a lot of different internships. So I worked in a lot of different labs on campus. I ended up interning at a biotech supply distributor called BWR. So that was towards the end of my time at Georgetown. And so I got this internship through working at the chemistry stockroom. I'm not sure if students can still work at the chemistry stockroom, but a few years ago when I was at Georgetown, you could get a part-time job there, and various companies would come and visit us. And so one of them gave me an internship when I asked for it. So for students who are looking for internships, they may be from really unusual places, but often all it takes is just asking somebody. So I worked at VWR for a little while, and that was kind of how I got my break into technical sales. So, and I think the goal here was to have me talk a little bit about the transition between Georgetown and technical sales, although I actually no longer work in technical sales today. So I'll talk a little bit about that path. I'll focus a little bit on that, and then I'll tell you a little bit more about what I'm doing now. So technical sales, basically the goal is to support some person, like a researcher, like a PhD level researcher, which is who I would sell to at BWR, or a physician or a nurse practitioner or a physician's assistant, genetic counselor, which is who I sold to in my second job after BWR, which was at Counsel. And so your day-to-day is basically visiting a lot of different people, some of whom are really nice and just the most amazing people you'd ever meet, some of whom are not quite so nice, and to tell them about whatever product it is that you have. So it really reminded me of one class that I did as a senior, which was a synthetic methods class, where basically we would have a recitation where we had to give a PowerPoint on a technical topic, like a technology. And I remember I did microwave synthesis. So basically it was just like a pitch for microwave synthesis. And that's just what I did every day, a bunch of times a day for 3 years. And it was really actually a phenomenal experience. It's a lot of fun to be in sales. A lot of people don't think of it as a career path, but it pays quite well. Definitely on par with consulting jobs or even some iBanking jobs. And it can be really stressful, but yeah, it's a lot of fun. So I left sales after a couple of years. I did my master's degree in bioinformatics at Johns Hopkins. And around the same time, I switched to a project management job at what was then Mount Sinai Genetic Testing Laboratory. Mount Sinai Genetic Testing Laboratory does a lot of different complex genetic tests, very similar to what I was selling to physicians when I was at Counsel. And actually, Jody visited us while I was there, a previous iteration of this class. And anyway, so I oversaw development of these types of tests for a while. I finished my master's and I switched into bioinformatics software engineering, still at Semaphore. And I left Semaphore about a year ago to join a startup called Biotia, which is working on similar highly complex tests, COVID testing, COVID sequencing, and just general infectious disease work. So I'm currently Director of Software Engineering and HIPAA Privacy and Security Officer at Biotia. I think that was most of the questions.
That's perfect. Sarah, if you could, and then we'll go through each question. Sarah, if you could answer the same, just tell us a little bit more about your career journey, that'd be great.
Hi, everyone. My name's Sarah. I graduated from Georgetown in 2012, and I was an international health major in the NHS. And while at Georgetown, I had 2 different internships that were kind of facilitated by the International Health Program. One of them, I worked at a community health center in DC, and I ended up helping them make the transition from paper records to an electronic health record system, and that'll come back into play later in my story. And then the second one was my senior spring. I interned at Futures Group, which is a global health consulting company in DC. And that one I actually was able to turn into my first full-time job after graduation. So I started working at Futures Group. I was on their knowledge management team, doing communications for a global health policy project that worked in HIV, family planning, gender equity, things like that. I was there for about a year and a half, and then I moved up to New York City, and I started working at the New York City Health Department, where I was helping doctors and community health centers adopt electronic health record systems. So that internship that I had at Georgetown came back into play, and I think I had a lot of empathy having been on the provider side, going through that and all the concerns about, what happens if our power goes out? Do we not have access to any records? How do we scan mountains of paper into a computer and get ready for this go live? So I helped doctors adopt new systems and then also start to utilize those systems to do various quality improvement projects and to try to leverage the grant money that was available through the government and through the Affordable Care Act to support that transition to electronic systems. And I actually got that job through connections through 3 different Georgetown alum who worked at the healthcare department. So network is definitely important, and Georgetown folks like to hire other Georgetown folks. Um, After 2 years at the health department, I went to grad school at the University of Washington and got a master's in epidemiology, a master's in public health. And while I was there, I focused on doing cancer research and health systems research. So when I came back to New York City, I worked at New York Presbyterian Hospital, which is kind of a large hospital system in the city. And I was leading projects in technology, implementation, analytics, and quality improvement. And then as of this past fall, I actually started a new job at Flatiron Health. Flatiron is a healthcare technology company, and they have 2 different sides to their business. The first side is a healthcare side where they have an electronic medical record system that's specifically used by cancer doctors or oncologists. So again, that factor coming into play. And then the other side of the company is the research side, which is where I work. So I'm a product manager, and basically I lead a team to develop customized data sets of patient data that comes from the electronic healthcare record to help understand patterns of care, patient outcomes, and help try to accelerate drug development in the treatment of cancer. So this is a really exciting role where I'm able to utilize my experiences in project management that I've built throughout my career, experiences using and customizing and implementing electronic health record systems, and then also epidemiology to try to pioneer new research methods and improve cancer care.
Okay, I think I'm next, right, Jody? Great. Hi, everybody. My name is Lynn Rosenberger, and I am currently a healthcare attorney with a large law firm in Washington, D.C. I think a common theme for all of us is that Georgetown played a really integral role in my career journey. So when I got to Georgetown, I knew I was really interested in healthcare, but I had no idea how I wanted that to translate into a career and was very confident I didn't want to go into medicine. And I took this great class my first semester. It was called Health Disparities. It was over in the med school, and it was all about how systems and structures both exacerbate health disparities, but also have the potential to affect positive change when it comes to health outcomes. And through that class, I discovered the healthcare management and policy major in the NHS. I'm not sure how many folks here are from that school. And I realized in those classes and in conversations with the professors in that program how much I enjoyed thinking about health policy, and just realized the ways in which an understanding of the law informs policymaking in a really important way. And so I was pretty confident by my junior year of college that I wanted to go to law school and I wanted to focus on public health. So I pursued a joint degree program, a JD and an MPH. I went out to Stanford for my JD program, and after my first year of law school, I came back east to go to Hopkins for a year to do my MPH. And Stanford really didn't know what to do with me, so they just counted that as my second year of law school, which was awesome from a financial perspective. And then I went back out to Stanford to finish my third year of law school, and I graduated in June of 2020. So very recently, I'm just now starting my quote unquote career. And I started with my firm in October. So I've been there a few months now, and I'm predominantly a regulatory attorney, but I work on some transactional issues too. And I know we'll talk about the nuts and bolts of that later in the conversation. So it's great to meet all of you.
Hi, everyone. My name's Genia, and I just graduated this past May in 2020 in the middle of the coronavirus pandemic. And I graduated as a human science major from the NHS with a minor in environmental studies that I did from the college. And currently, I'm working as a research analyst at advisory board. And I had maybe, I think, like 2 or 3 internships during my time. Like every summer, I had something going on. And I can definitely speak to those more in detail if anyone's interested. But I did a wide variety of different things, as all the other speakers have touched on. Doing all those different things informed kind of what we wanted to do after graduation. And I'm still in the process of learning what I'm still into and what the workplace is like, especially virtually. But I'm looking to get my MPH later on in the next couple of years or so. So kind of gearing up to apply to graduate school as well. But my journey is short thus far. So I will pass it off to the next person.
Hi everyone, I'm Rachel. I also just graduated in June, in the middle of the pandemic. I was also a healthcare management policy major at NHS. I know we're few across here, I think about like 30 people. People always call us the unicorns of Georgetown, which I take as a compliment. But my whole career so far has really just been stumbling upon opportunities that end up turning to blessings. So when I came to Georgetown, I wasn't actually sure if I want to be in healthcare. And then I took a class freshman fall called Healthcare America. And I was like, yeah, this is what I want to do. I want to be in healthcare the rest of my time, or at least the next 20 years of my life. So then I knew, but I wasn't sure what I wanted to do in healthcare. And it wasn't until sophomore spring that I did like a day in consulting at PwC, and it was like, this is really interesting. You know, it's not as bad as I like imagine it to be, or as like some people at Georgetown like stereotype it to be. So I was like, let me pursue consulting, applied to a bunch of internships, didn't get them, and actually went to a MedStar research fair that was mandatory by a professor, but I didn't actually want to go. But it was a blessing because I found a really great internship project. And so my first internship was a journey design project to help caregivers who are caring for their parents with Alzheimer's and dementia. So that was really great. It's a small internship. I got to learn what journey mapping is, what human-centered design is, learn more about what caregivers go through. And then at the same time, I was also able to pick up an internship at the US Department of Health and Human Services at a speechwriter intern. And so that HHS internship actually ended up spanning about a year, which is great because I just asked my boss if I could keep coming back. And I only had to go once a week. So it's really, really nice while I got the experience. And then junior fall, I ended up recruiting for consulting, applied to a bunch of internships again, got recruited, almost gave up, and then Booz Allyn decided to give me an offer. So I ran with it, and then I spent that summer doing an internship, doing my project in decision science and with the Food and Drug Administration, and actually almost decided not to go back to consulting because I faced what I think some of you guys will encounter and what some of the panelists have encountered too, imposter syndrome. But luckily I had talked to Jody and decided to go back to Booz Allen. So I've been at the firm for a little bit less than 6 months. And during that time, I've worked on proposals, business development projects, which I've got to present to upper leadership, which is really cool. And then right now I'm on a project for the National Institute of Health where I'm a program coordinator for a small work stream called Business Relationship Management, where we work with the various divisions and offices at NIH to stimulate surface demand opportunities for my clients' technological capabilities. So looking at what solutions can we develop to help deliver and meet their needs. And yeah, so that's what I'm doing so far. What I want to do in the future, I couldn't tell you. I could wake up one day and tell you I want to do one thing, and the next day I'll tell you I want to do X, Y, and Z. But that's the beauty, I think, right now of being in a career and exploring, that you get to explore your interests, and you can't take a wrong turn. Just make sure you stick with what you want to do.
Thank you, everybody. And for those of you who don't know, imposter syndrome is when you're afraid people are going to find out that you can't do it, you're not qualified. And many of us, this often used with grad school. You think, how did they let me in? I shouldn't be here. And so sometimes you might feel that in your career. And if anybody wants to speak more about that with this event, you're happy to do that, or in your breakout rooms. But that can be a common feeling. So thanks, Rachel, for mentioning that. All right, well, I think the next question would just be, what is the day-to-day? So as students think about, all the different options in healthcare and, but you know, and these are great jobs and a variety of jobs we have on this panel, but what do you actually do on a day-to-day? And I know, you know, we know your day's different, your week's different, but if you were to try to kind of share what that might look like for a student. And Joe, I'm going to prompt you a little bit because I want to hear about what you do now, but I also really thought it was interesting when you talked about client services at Semaphore and what that looks like. So if you could also share briefly about that, that'd be great.
I'm muted. Sure. So yeah, I've had a pretty broad spectrum of roles between sales and project management and software engineering, and I'll talk a little bit about each one and kind of how they differ. So I really feel like sales is like having to present something all the time. It's also a lot like interviewing for a job. So if you think about going into that interview and you've like done your research on the company, you've got your resume ready, you've kind of polished your thoughts about what you're going to say, and then they ask you questions that are totally out of left field that you could have never possibly prepared for. And then think about doing that like 3 to 5 times a day, every day for months. And you get really good at it, but it's definitely stressful. I think maybe that's the best analogy for that. In terms of project management, so that was definitely a lot less stressful. Essentially, it's a huge amount of meetings, and you're often the person who's in charge of the meeting. So like setting the agenda of the meeting, making sure that everybody contributes, making sure that everyone gets their work done. So if you've ever been that person who was like in a group project and you're like, okay, I'm the person who's carrying the group project, that's pretty much being a project manager. So if you're the type of person who likes to be the person who makes sure that the assignment gets in, that it gets done right, you know, everybody does their part, that's a pretty good metaphor for project management. And then in terms of software engineering, so software engineering is different depending on the company. I'm more on the sort of data science side of software engineering. So I do a lot of one-off analyses and also building production systems. So what that means basically is that some researcher will come to me and say, hey, I need to understand this thing. And it's a lot like maybe doing a lab report that you did in undergrad. So like if you took like chemistry lab or biology lab, like writing up that lab report, doing all that kind of analysis, I would say that's maybe closest to what I do on a day-to-day basis.
That's great. Thank you for describing all 3 roles. Appreciate that. Sarah, and I know you were a project manager too. So I don't know if you want to speak to that at all before your product management role.
Yeah. And I actually, kind of the type of product that I manage right now is a little bit different than typical product management in tech, where you might be like rolling out a new feature or a new platform. The products that I am managing are these data sets that we're creating. So I honestly think that my day-to-day is fairly similar to what my day-to-day was as a project manager. And I think Joe did a great job of describing that. It is a lot of meetings. I think, you know, the team that I work with is very cross-functional. So we have like clinical researchers, we have engineers, software engineers, we have statisticians, we have people who know the ins and outs of the FDA regulatory requirements and what you need to do to get a drug approved. And then we also have a whole team of clinicians who abstract data from the electronic medical record. So every project that I lead combines a group of those people, sometimes additional folks as well. And we follow the kind of the Scrum methodology of project management. So every Monday we have a sprint planning meeting where everybody gets together and we talk through kind of what are the overarching goals and what are the tasks that we need to get accomplished for each project that week. And then every other morning, we start the day with like a 15-minute stand-up meeting. And that's where each person on the team goes around and they say, this is what I'm working on today. You know, this is my big priority. If you have any issues or problems that you're facing, you share those as well. So we use that. And I think that system is particularly helpful when working remotely. When you don't have any coworkers next to you, you could just turn around and ask a question to. So having that many built-in checkpoints throughout the week is definitely helpful. and helpful for me because everybody on the team is now going off and doing their different tasks, and they're all interrelated. So having those touch points where you can tell, if the thing that I am doing is going slower than expected and that's going to impact somebody else on the team, then we can share that information. In addition to those meetings, we also have meetings like within product to brainstorm new products and internal ways that we can be more efficient in our work. And then we have project meetings as well, where everybody comes together and discusses where we are and any issues that we need to work through. So it's a lot of meetings, a lot of facilitating meetings, taking notes, following up with people about action items, a lot of kind of figuring out how to document information that could be helpful for a future project, or figuring out how to communicate information to a variety of different audiences. I think that's a skill that's been very helpful in all of my jobs. If I'm trying to help a doctor who is trained in medicine understand what is the policy on electronic health records, or how do I, customize the system to work for me, you have to figure out how do I explain this very technological thing or very policy-based thing to somebody who did not study those things. So I think figuring out how to kind of translate and communicate things to different audiences has been really important, and is definitely important in cross-functional roles.
Perfect, thank you. And now the next three of you, are relatively new, but it'd be great too if you could speak to, Allyn, like a specific client to give us an example, and Rachel and Jinia to your projects that you're working on, so we can understand what those are. That would be great. So Allyn.
Yeah, so as a very junior attorney at my firm, my days completely depend on what partners and more senior attorneys ask of me. But essentially, our clients, which are predominantly hospitals and healthcare systems, come to the firm with questions about the really complex laws and regulations that govern the US healthcare system. And it's my job to research those laws and regulations and try to come up with an answer for them. So in my 5 months I've been with the firm, I can pretty much divide my work into 4 main categories. The first is, right now I'm spending a lot of time researching and understanding the vaccine distribution processes across states, the COVID vaccine. So as states move into their different vaccination phases that include people other than healthcare workers, a lot of our clients are having questions about who they can vaccinate, when, how, what privacy and other legal issues they should be considering. And so I work through a lot of those issues with the client. I've been on a lot of calls with clients, which has been really great as a junior attorney to be able to facilitate meetings and calls with our clients. And I also help them draft up contracts and agreements to help them set up mass vaccination clinics. So you've probably seen across the country places like big stadiums and other public areas are opening up mass vaccination clinics, and a lot of our provider clients are interested in participating in those. And so I help them draft the agreements to facilitate those clinics. Another big bucket of my work is telehealth and telemedicine. So the regulatory field for those spaces is changing every single day. I track state developments, and every morning I have like 50 notifications in my inbox about new laws and regulations and proposals in different states, because telehealth was rapidly advancing prior to COVID, and now with COVID, it's just totally it's exacerbated the speed at which that world is progressing. And so it's my job to stay on top of those changes. And then when clients come to us and want to set up telehealth platforms, we guide them through that process. So that's really fun. And probably my favorite part of what we do is helping our clients set up telehealth platforms that are compliant with the existing laws and regulations that govern them. The third big bucket of my work is transactional. So healthcare firms oftentimes have really large transactional practices, and that just means that you're facilitating mergers and acquisitions essentially between hospitals and health systems, which is happening more and more these days. And so I can really just sum up that work as reading documents. I'll spend all day reading documents that companies provide us to make sure they're compliant with relevant laws ahead of either selling or buying a business. And then the fourth bucket of what I do is policy focused. So as a HCMP major, I've always really been interested in health policy, and our firm has a consulting arm, and so they're doing a lot of advising on policy matters for our clients. And I spent a lot of time working with them, especially as we enter into this new administration. There are a lot of upcoming healthcare policy changes. And so I do a lot of writing on that, both public facing to publish and then for our clients. So those are the main 4 buckets: vaccination research, telehealth research, transactional support, and policy work.
That sounds really cool. So for my work as a research analyst, I'm on the cardiovascular roundtable team at advisory board. And basically what we do is we provide best practice research to health systems and some other health companies that are interested in staying afloat in knowledge about hospitals and health systems and what they're up to. So from the cardiovascular roundtable, we tend to provide more like clinically related information, but that's not always the case. We're not confined to our teams exactly. So 2 of the big projects I've been working on recently, one has been about social determinants of health, which I'm sure a lot of us are familiar with from our health disparities coursework at Georgetown. And we looked into ways in which clinical service line leaders, so hospital health administrators, cardiovascular leaders in hospitals, people like that, could pursue health equity measures and make sure that their patients are receiving the best care possible, especially because that is one of the concerns at the forefront of this new value-based care system in health and, you know, insight into health disparities that's available now. So we called a lot of different individuals. We collect a lot of qualitative data in which we contact different organizations that we think are doing really cool work. We're able to also use data that we have on our side, but we wanted to hear some stories so that we could share those stories onwards to actual clinical service leaders and show them, look, like these people are doing this, so you can do something like that for your population as well. So that's been really exciting. And then another project that I've been pursuing is looking at service rationalization, which is more or less looking at how hospitals decide to close or consolidate services and see how that's relevant to their financials or quality and how that affects their communities. So it'll be the same type of cycle where we look to see who we can contact, we look to see, have these interviews and conversations with people, and then making a content piece based on that for our members who are subscribed to all of our content. So it's been really great in that regard. And I would say on top of that, there are opportunities to do other things. So I've had ample opportunity to have conversations with a variety of different colleagues of mine about, you know, what they're up to, maybe even get myself involved in their projects a little bit. So it's not just confined to, you know, my little team. I'm able to also explore so much that's available at the company.
I can give 2 versions of what a typical day looks like. So one of them, I can give a sense of what a day looks like if you're on a bench, which is what Booz Allen calls people, or calls it when you're unbillable, aka you don't have a project. And that's perfectly normal. If you're joining a firm, unless you're hired directly onto a project, you're going to be on a bench for a while. So for me, my day on a bench might look like if I'm on a proposal, I hop on in the morning on a call with my proposal manager to go over edits and what things we need to do, what people we need to do, like if there are writers who are slacking, we'll be like, okay, we need to like ping these people to make sure that they are put in their content before our stand up at 5 p.m. Or it might be, okay, we just got edits from the color team, which is upper leadership reviewing our proposal and say like, okay, we're going to put these comments in. This is what we need to focus on. Sometimes it's content, sometimes it's formatting. And then, you know, I'll work on a proposal for half my day. The other half of the day, I'll work on other business development projects, which can be looking at research, compiling a deck, or using my research to create findings to present to leadership that is interested in pursuing more work on that marketing project. And then at the end of the day, I usually wrap up my day with a stand up with the proposal team where we go over what we've done, what needs to be done, how can we make this proposal better, you know, if the proposals due on Saturday, what else do we need to do to make sure it's wrapped up in a bow so that we can win. Another day, the other version of my day is if I'm on a project. So every morning I have a stand up that's half an hour. So I will share my screen, and in my team, we have a task tracker. So we go through each task and we say like, okay, this is what the updates are. Are there any concerns? Are there any problems that we anticipate? Any updates? Because, you know, everyone's busy. Sometimes we don't always get to talk to each other throughout the day. And then we finish up our stand up with any lingering questions, any updates. And because we're such a small team, our updates are usually fun. We usually talk about personal lives or, you know, joke around with each other because we're also comfortable with each other. And then usually if it's a really busy day, we'll have meetings like throughout the afternoon. So this past Monday had meetings for like 3 hours, which is really fun when you're sitting down for 3 hours straight. And one of them was like a check-in with our client to show them this is the work we've been doing on. We want to show you this assessment that we've been working on, get feedback from them so we know how to improve and how to better apply this assessment to the various divisions and offices we're going to talk to. And then after that, I had like an admin meeting, which is our whole project gets together. We talk about any updates to our project. Sometimes we highlight a specific work stream. We introduce new people. And then I have a one-on-one with my job leader, which is what Booz Allen calls your boss. So I talk about my day, any problems I'm having, you know, what any updates she needs to give to me, things that we need to talk about regarding our client. And then that'll be the end of my day. Other days I just have work, which is nice because I don't get interrupted as much and have 8 hours of time where I get to focus on things, which I will admit sometimes is a little bit exhausting when you're staring at a screen straight for 8 hours, 9 hours. So I make sure to like sprinkle in like networking, chats with my people, or just chatting with old friends, or just going to walk with my dog. But that's essentially how it is. Either it's really meeting heavy or not.
Great, thank you. I'm glad you said a walk. We all understand the Zoom fatigue, everybody on this call. All right, so let's take 1 minute each. So really quickly, now that you know what you know, is there anything that you would have done differently during your time at Georgetown? So Joe, you go first, real quick.
Yeah, absolutely. So the greatest thing about being a student is that you have the opportunity to be bad at something. And by be bad at something, I mean be new at something. So you come in, you say, I'm a student. No one's gonna worry if you don't know anything. So what I recommend and what I wish I had done more of is just try as many things as you can. So if you pick your industry, you're obviously interested in healthcare, try to do something healthcare finance, try to do healthcare sales, try to do something project management, try to do software, try to do, shadow a doctor or something. Just as much exposure to as many things as you can so that you can really figure out what you want to do.
Mine is very similar to Joe's, but maybe I'll apply it specifically to classes. I think as an iHealth major, so many of my classes were kind of planned out for me. I didn't even have to think about them. I said, okay, these are the 4 that I take this semester, and maybe I have 1 elective. And I didn't really start doing it till my senior year, but I looked outside the NHS to see what else was there. And I took a linguistics class, and it was awesome. And I learned about cross-cultural communication, which I think has been key and so relevant to my professional life and success. And another one is I ended up taking like a grad school class in the bioterrorism major or something like that, that, I was interested in learning more statistical methods. And my professor said, we don't have any of that in undergrad, but hey, look at this class. And that was also one of the most interesting classes I had ever taken and didn't know it was even available to me as an undergrad. So I think, get creative. If you want to do a minor, pursue that. If you have electives, you look beyond what your school or what your major is offering and see if there are other things where you can maybe build skills or just broaden your knowledge base while you have access to all of these amazing professors and classes at Georgetown.
I was going to say something very similar to Sarah, that I think you all know you're immeasurably lucky to be at Georgetown, and some of my favorite memories are taking really random classes that I just kind of discovered on a whim. I know for me, it was really easy to be laser focused on what I wanted to do, both in courses and internships and extracurricular activities, because like I said earlier, from the time I started at Georgetown, I was pretty confident in what I wanted to do. And I think taking advantage of some of the resources Georgetown has, you're never going to have the chance to take some random class and who knows what again. And I certainly wish I'd taken more advantage of that when I was there, and hadn't waited until my senior year to take some classes that just sounded fun and weren't at all related to healthcare in any way. So I would encourage you to look into that sooner rather than later.
And if Rachel and Jinia, if yours is similar, feel free to also give, if there's any advice or something you did at Georgetown that you recommend.
I think this is something I recently learned from the working world, but I wish I had done more at Georgetown, which is advocate for yourself. So you're not just stuck with, whatever internships you have, whatever connections you have. You can use those to do so much more with them. And similar to what everyone else was saying with trying new things, like tell your internship boss that you want to try something new. Like they won't hold that against you, or at least they shouldn't. And if you ask for it, they might just give it to you, and it might be like the next best thing that you encounter, right? So as long as you feel comfortable advocating for yourself and making sure you're getting what you want out of your experiences, you'll be like set and ready to go. So I wish I did more of that while I was in college, and I hope that you all will be able to do that while you still are.
I would say I will say that when I was a sophomore, I went down what I call like a black hole on LinkedIn, which is where I was trying to find alumni who were in consulting and then looked at their profiles to look at what they did and to prepare themselves to get that consulting job. And I kind of created this idea that there was only one path for me to get into consulting, which was I needed an internship in consulting sophomore summer, or otherwise if I didn't get the internship sophomore summer in consulting, I wouldn't get that big internship junior year that would lead to a full-time offer senior year. And so if I didn't get that, that meant I wasn't going to achieve my goal, which is obviously false. You as students, explore your interests. Like Joe said, you have all this time to explore what you want to do. There's so much to do out there, whether it's healthcare related or not. And so don't worry too much about whether or not it's going to lead you down to the right path, or if it's going to lead you down to consulting or policy. Explore your interests. And at the end of the day, there's always a way to tell that story on a resume. There's always a way to tell that story when you're talking to your interviewer. It's not so much being like, I think the recruiter thinks I do mark X, Y, and Z. It's about what can I bring and how can my experiences show that. So don't worry too much that I have to follow everybody else's path. Create your own path.
I appreciate that perspective. It is, yes, we're going to have another panel, we hope, in the future on just non-linear zigzag paths. Like there's just all kinds of ways to get places. So before we get into the Q&A breakout, I just want to, I'm going to stop recording, but I want to give a virtual thank you for you all for sharing your stories and your advice. This has been great. I'm going to stop